People ask me, how do you know what's abnormal, what's not, what's normal? We have these very fancy tools, we call them our mapping systems. These are three-dimensional GPS navigated tools that we use in the heart to figure out where the abnormal connections are. So it's almost like, the next one, almost like doing using the GPS system in your car. We go in there, we map out the electrical system in the heart. Each one of those little dots that you're seeing is an electrical signal in the heart that we have captured, and we know where the scar is in the heart, where's the good tissue in the heart. Next one. And we have multiple different ways of figuring these out. We can figure out which direction those arrows tell us, which direction the electricity is traveling in the heart. We know where it should travel and where it should not travel. Next one. And it helps us figure out what is the best place to target. And once we know what's the best place to target, we go into those areas, next, and find those areas. We make sure that it's not anywhere close to any of the important structures in the heart, because the heart is in the center of the chest. There are things in the heart, like the arteries, the nerves, the electrical system that's normal. There are things surrounding the heart, like the esophagus or the food pipe, the lungs, the nerves. So we have to make sure that we don't damage any of those tissues. So we find out where those areas are. We look at where the abnormal area is. We make sure that it is in a safe place for us to fix. And if it is in a safe place, Kevin, next. We go and apply this heat energy and we fix that short circuit. Sometimes, I'll never tell people that ablation is a cure for atrial fibrillation, because atrial fibrillation happens because of tons and tons of short circuits in the heart. So we might not be able to target every single one of those short circuits, because some of them might be close to important structures in your heart or surrounding your heart. So there are sometimes we have to leave some of them behind, but the goal for an ablation is to take care of as many spots as possible so we can cut down the burden of your atrial fibrillation.